Hi, my name is Madison Wentz, and today I'm going to be presenting on the topic of the role of exercise in mental health. I'll be analyzing 4 articles on the topic. First, some background information. How is exercise involved in mental health? Exercise is known to be the most effective and the quickest way to improve one's mental health. It's known as meditation in motion because the body is focusing on its rhythm. It focuses on its breathing, the movements, and the task at hand. Exercise releases endorphins into the body, which is the body's feel-good neurotransmitters. They help improve concentration, self-confidence, and optimism. Exercise also decreases feelings of anxiety, depression, ADHD, and PTSD. The first 2 articles are popular press articles. These are articles written by anybody with any information. They're available to everybody online. The first is given to us by Psychology Today. It focuses on the impact that exercise has on the hippocampus in the brain. The hippocampus controls memory, learning, and emotion control. Exercise has been shown to help with regenerating new hippocampal neurons, also known as neurogenesis. This plays a major role in memory storage because it allows new and old memories to be stored separately. This allows somebody to learn from their past experiences and allows them to stay out of situations that cause them stress. The second article is given to us by Exercise Right. It is a more generic and broad article. It gives information on physical activity as a treatment option and also helps give tips. It states that exercise alleviates many symptoms of mental illness, and the mental illnesses given were anxiety, depression, schizophrenia, bipolar, and multiple personality disorders. It says that they can also help reduce the side effects caused by medications. Medications can cause one to be fatigued, depressed, and even gain weight, where exercise helps one's mood boost. It helps them become more alert, and it even helps weight loss. The last 2 articles are peer-reviewed articles. A peer-reviewed article is analyzed by other doctors or scientists to make sure that the content is accurate and credible. The first article was a study done in Brazil by Kleeman, Brech, Stanton, and Such. It states that exercise is an underrated and underused form of treatment. It also goes to say that the first line of treatment for mental illnesses are medication, and that they only provide short-term benefits for a long-term disease. It states that medication can only mask problems, but it does not actually solve them. So the team decided to create a study to ask why exercise isn't used more frequently. To do this, they created 2 questionnaires. One was given to patients and one was given to doctors, asking about exercise as a treatment. What they found was that doctors don't prescribe exercise as a treatment because they are unconfident in their training and the knowledge of the topic. The last article was produced by Ulm University in Germany, and it focused on the mental health and well-being of college students. They produced a 6-week evaluation of stress, where they asked college students to come in and they rated their stress of the day. They then went through various exercises and workouts, and they ranked their stress afterwards. What was shown was that low to moderate intensity aerobic exercise effectively reduced symptoms of anxiety, depression, and it also boosted mood and the well-being of the college students. In conclusion, there was a difference between all 4 articles, but the information given was very good. It stated that peer-reviewed articles are assessed by doctors or other scientists to make sure information is accurate and credible, where popular press articles have free range of what information is put out there. Popular press articles provide more general information and allow the articles to be more condensed or shorter, where peer-reviewed articles are longer and more detailed. All 4 articles analyzed gave an array of information on different angles of the common theme, but they all showed that exercise is a necessity in improving one's mental health. Here are my references, and I hope you enjoyed my presentation.